Good afternoon. My name is Jose Melendres, and I'm here as a part of the Southern Nevada Health District's Chipping Away at Health Disparities initiative. I am with the Policy and Funding Committee, and as a part of this work, we are going to be conducting some interviews with key community folks and leaders working in this area. For our first interview, I'm here with Assemblyman Tyrone Thompson. Thank you for being here, sir.
And
would you please introduce yourself and also, which district you represent and all that good thing.
Well, I'm Tyrone Thompson, a native of Nevada, actually of North Las Vegas, which is the area in which I represent in Assembly District 17, mainly in the new and growing community in North Las Vegas. So. Just really excited to be here today.
Well, thank you for joining us. So, as you know, we've been doing some work around health disparities and health equity issues. Some of the things that you've been championing in your work as a legislator and as a community leader. And so, with that, we'd like to ask you a series of questions and give us your response and what's going on with that. And so, the first one again. In your role, both as a community leader and as an assemblyman, where do you see some of the biggest issues when it comes to health equity that are impacting our community today?
Well, there's lots of issues.
Sure.
But I would say, well, the first is access. Access is really important. We can't just assume that people know where all the different places where they can address their health needs are. And then we can't assume that they have the resources to get there. So that's always one thing. Also funding, because there are so many disparities, depending on what you as a person need, we need consistency in funding. And that's always a challenge because we always look to grant dollars. The grant dollars are pushed down from the federal government and then passed through to the state and then into our communities. So we have to look at that. We also need to have an area where we can look at where the policy is at. Because we can't assume that health issues that we had, say, 20 years ago are still the same health issues that we have now. It just shifts. Our community is continuing to grow. We have different ethnic groups and cultural groups that are either swelling up in numbers or decreasing in numbers. And so you have to look at that whole equation across the board.
Okay. And when it comes to the health disparities, when it comes to health equity issues, and you just stated some of the things, right, when it comes to the changing population, why should we as a community, why should we be concerned about that? Where's the impact of that?
Well, the most common reason why is because a healthy community, a healthy economy, so on and so forth. I mean, if we don't have kids that are healthy, they're not going to do well in school. If we don't have healthy people that are in our workforce, then that's going to be a problem. The more that people are not healthy, they're going to continue to drain the dollars, and especially if people don't have their own insurance, and if there's insurance that has to be paid through other means, we're going to continue to drain that. One of the areas in which professionally that I've worked in is like around homelessness. And a lot of times a person that's homeless, if they have just a cold or just something very minor, they're going to access our hospitals. And that could be something that probably could have been remedied if we would teach them the right ways to take care of themselves. Because even though they're out in the streets, we can't underestimate the people that are living out in the streets. They're very sharp, warm people, and if we can give them the tools, so education is a big part of it as well. So. Okay.
And so in your role as a legislator, and with the session about to kick off, which we're grateful you were able to make time to be here today,
that's right.
What can you do? What do you see yourself being able to do this session when it comes to addressing these issues in your role as an assemblyman?
Well, the first thing is the Governor Brian Sandoval, he had his State of the State address on the 17th of this month to basically outline the key areas that he wants to fund, the areas that he wants to champion. So that's the big thing, that because we have to balance our budget every 2 years. We have a biennial legislature where we only meet once every other month, every year, and in the odd numbered years. So that's one thing. We have committee work, and so I'm very honored to serve on the Health and Human Services Committee. So I will be that strong voice when the bills come forth, and I'm also able to drive bills too. I actually have a bill that's going to address minority and equity issues in health.
Right.
That's where I play my part, but I also need to empower my community to make sure that they support the things that I'm talking about when it comes to the legislative session, because I think people think, well, I voted for you,
That's
now
enough.
handle it.
Right.
And it is expensive to purchase a ticket to go up to Carson City, but we have another way that you can do so by going down to the Grant Sawyer building at 555 East Washington and listen to the hearings and actually go up and testify. It can be scary, but believe me, those are the testimonies that we want to hear from our community and help validate why whatever we're trying to promote is so important.
And you just tapped into the final question I was going to ask you. That,
Okay.
that we as community folks,
Right.
you've got this effort with chipping away at health disparities from the health district with their leadership. They've brought a bunch of folks together around this work. What can the community do? I mean, you just identify, go and testify. If you can't get up to Carson City, you can go down to Washington and go to the state building and testify. What else can we as community folks, these types of work, these types of coalition, what can we do to help and support these efforts that you're going to be up there in Carson City representing and fighting for?
Okay, well, a few things. First of all, you need to go onto our legislative website, which is legleg.state.nv.us. People can actually go in and set up what we call a personalized legislative tracker.
Okay.
So when you're on the website, in one of the columns, it'll say BDR list. So BDR stands for Bill Draft Request. Click on that link and just kind of peruse it, because it may not just be health things that you're interested in. We're looking at our entire state, what's going to be happening. There's well over 800 bill draft requests right now. You go in and say, for example, since we're talking about health, there are 8 areas of health that you're interested in that one of those bills might be. You set up your own user ID, password, and then you can actually input all of those BDR numbers. And because we have busy lives, it'll send you an email alert as to when the hearing is going to happen on that bill. Whatever movement is happening on that bill, you will have that. So that's one of the key things I always try to tell people, you must do that. You can also stream live. So if you're at work, if you're allowed to, if you're at work, you can actually look on your computer and watch the hearings as they are happening. But we're talking about the state level, but we also need to make sure we look at the local level as well. We need to pay attention to what are some of the best practices that are happening in the United States so we can bring those back to our community. And I'm really proud that we have a lot of best practices and evidence-based theories that we're doing here in our community. So there's a lot that the community can do.
And so to close this out, from your perspective, your role, your engagement, when we say health equity, I mean it's a big ticket item right now.
It is.
What specific things come forward for you when you talk about health equity? Not only engagement of communities, you identified access to health.
Mm-hmm.
What 3 or 4 other things maybe for you come to the top? If you're saying, this is something it's going to get very personal for me. What are those areas that you identify that come forward for you?
Well, I think that we need to get rid of stereotypes and assumptions, and I'll just leave that for whoever's listening, that they understand that there's just a lot of assumptions about disparities. I'm glad that we were able to do that research, because previously we established the Office of Minority Health. I'll talk a little bit about my bill. The Office of Minority Health, and it was established in 2005. Well, that's what it was called, the Office of Minority Health. But doing the research and seeing how things have evolved, we're now going to change it to the Office of Minority Health and Equity. Now it makes it more inclusive of just the ethnic groups, but now it includes the disabled community.
Right.
It includes the elderly community. It includes the LGBTQ community. Those are a lot of the communities, and we could argue all day about who has disparities, but these truly are, we have the data, we have the hard facts. These are the communities that if we don't do what it takes to address their health concerns and needs, again, it goes back to, are we going to have a healthy community? People look at Southern Nevada as a mecca for a lot of great things, but if we don't have a healthy community, we're losing out on a lot.
Okay. Thank you for your time, sir. We appreciate it.
All right.